Hi, everyone. Welcome back to the Medical Care Redefined podcast. Today's episode is one of my favorite topics. It's about weight loss. And I would love to hear from you, Dr. Nguyen, how you even got into weight loss from being a family care physician.
So when I was in residency, I was already very passionate about weight loss because a lot of our patients came in because they're obese, but then they also have diabetes, hypertension, high cholesterol, and all that stuff. And the way that we were trained was just to kind of manage their A1C and then cholesterol and all that. But really the big problem is their weight is the underlying issue. So if we can kind of like manage their weight, then we can like fix everything else, right? And so that's kind of where I got into like, I think that weight should be, if obesity or weight is an issue for a patient, we should not ignore that. Because I know a lot of patients get uncomfortable about talking about weight, especially, going to doctors like, oh, like doctor's telling me I'm fatty but I think that if we approach it properly, like, not saying, hey, are you interested in us helping you with your weight, not having the patient feel inferior. I think it is a really huge issue that if we can done right, it can change a patient's lives. Like nobody wants to take a bunch of pills, like diabetes, like blood pressure medicine, cholesterol, and all that. So if we can kind of fix the underlying cause, it helps with that. And so that's kind of where I got into obesity, even the beginning of residency. But when in residency, we weren't really trained a lot in weight management. Everything was just kind of like, there's not really a proper guideline until after I graduated from residency. I still was very interested in weight management. Then I decided to get board certified in obesity medicine, trying to take a really like a bigger dive into the disease process, right? Because I think that a lot of primary care physician or just in general, the population thinks that like, the patient's just lazy and they just don't exercise. Therefore, we just tell them, oh, you need to eat this and you exercise that. But there is such a big impact on what is going on underlying all that problem. So if we can look at obesity as a disease, then we can treat it differently and not just a taboo that the patient's lazy, right? And so when I really understand obesity more through the board certification, that allows me to look at the disease at a whole different level. And I think that that's when like the big change like occurs in my practice, and the way the style of medicine I've approached has really been game changing for my patients is because I focus on the disease process, not so much of like, like treating the patient that like, oh yeah, you're just lazy, like
yeah, so you're not just treating like the one factor that you've seen, but it's more like, okay, how do we approach this as a whole? And I think we need to touch base too, because I think even when I talk to patients who are coming into the clinic for the first time, it's not just about it's not just about weight loss, but also weight gain, because there's other types of obesity. Can you touch base on that so people know?
Yeah. So we have like, there's the regular, like when we have this fancy body composition that is very unique in a sense that can scan percent body fat and percent muscle mass. Some patient, they come in and their weight looks normal, like compare average, but when we scan it, their muscle mass is really low and their fat mass is high. That's considered as sarcopenic obesity, meaning you're skinny fat. Like that's not healthy either, because you can still have high cardiovascular risk. You still have stroke and heart attack and stuff like that if you have a high visceral fat and a higher fat mass and a lower muscle mass, because that's not healthy. Then on the other hand, there's some patients who are very muscular, they work out a lot, and their BMI may be high, but their fat mass might not be very, like an athlete, right? They're working out. Their BMI may be in the 30s, but because they're so muscular, their fat mass is low. So technically that patient is not obese because they just have a lot more muscle and little fat. So also the technology that we have allow us to determine truly, are they obese? So somebody could weigh the same, but they could look different depending on like what their composition looked like. So I think that like in the old world, we use height and weight, and a lot of physicians still does that, which is okay to an extent. But if we really want to manage weight, then we really want to truly give this person, hey, are you obese or not? We should not use just a BMI alone. BMI is just measuring their height and their weight. If their composition is different, they have more muscle, a little fat, they may still have a higher BMI, but they might not be obese, right? So, or they might not have risk factors of stroke and heart attack. So I think that that's really important to determine how do we diagnose that. And I think a lot of us use the old style because it's easy and it's cheap, but it's really not the right way to do it.
I agree. Yeah. So I think just to kind of like help people understand a little bit more, sometimes we do have patients come in who are just like an average height, but they have a lot of muscle, and then it actually appears that they have obesity because of the BMI, right? And then even older patients, the elderly ones, who are like, oh, I'm not overweight, obviously, but they actually are sarcopenic obese because they don't have enough muscle mass, right? So
That's
those are
correct.
kind of other things to think about that's more than just weight loss that people kind of think about negatively. What would you say, and I know you know this field, but what are the contributions to weight loss that people should kind of look at that's more than just the weight and height?
Yeah, so a lot of patients, like, they would come in and they would come nutrition evaluation for them and kind of do a consult. And they're like, Dr. Nguyen, I barely eat. I'm only eating 1 meal a day. Why am I gaining weight, right? But then and then you kind of ask them other questions like they're stressed, they're not sleeping enough, they have a family history of obesity, and they're eating really late at night. So like there's a lot of contribution, and they have really bad allergies. They take Benadryl every night, right? So there's contribution like stress causes weight gain, right? So stress causes increase in cortisol. Cortisol is a steroid that causes weight gain, and it also increases ghrelin, which is the hunger hormone, makes you eat more. So that stress is a big contributing factor. Sleep, right? So insomnia or obstructive sleep apnea can also cause weight gain. Why does it do that? Also increases cortisol, also increases ghrelin. That makes them gain weight. Then their hormone. I mean, hormone's a big thing. If their hormone's imbalanced, in men, if their testosterone's low, they cannot lose weight, and they tend to have central obesity. Women, same thing in the menopause. They have low testosterone, their hormones all over the place. They're going to be stressed, and their progesterone's low, they can't sleep. So that's also contribution toward their weight. And if they don't have testosterone, it's a metabolism hormone. It's going to cause them to gain weight. Vitamin D deficiency is very common. Like a lot of doctors don't even check it, right? But vitamin D deficiency can cause weight gain. So it's something simple that we check. An Asian, we tend to be vitamin D deficient because we're lactose intolerant. We don't drink milk. In Caucasian, they are like, when they go out in the sun, they burn. And then in African American, they don't go out in the sun at all because of their dark skin. So like everybody has a reason of why they're vitamin D deficient. But, it's very rare that like somebody who gets enough sun, but like, eat enough milk, dairy products and whatnot to kind of get that adequate vitamin D. And then the other thing is medication. So there's a lot of medication that cause weight gain, like Benadryl, like I just mentioned, it's an antihistamine. It slows down the body. It makes you gain weight. And sometimes you just think, I'm just taking a Benadryl at night to help with sleep and then the runny nose and whatnot. But that easily can cause weight gain. We can use other things, like, if you're not sleeping well, melatonin would be an option to switch out to, and other measures. And if allergies, we can use Flonase, single air. Those are things that are not weight positive.
True. And
then like anxiety medicine, like the benzo, the Xanax, the clonazepam, those are weight gain medicine. Like pain muscle relaxants are also weight gain medicine because they're relaxing. Like gabapentin, nerve pain medicine, those can do that. Sometimes our goal is to like evaluate the patient and see like what they're on, what are the options I can switch them to. And sometimes you just can't. Like they're stuck on that medicine and they need it, and so we just kind of have to work around that to help with the weight loss. But that's contributing factor, medicines. And then their eating habits, right? Yes, so like if they're eating a lot of carbohydrates, a lot of sugary stuff, of course, that causes weight gain. Inactivity can also contribution of that. And then whether they are, how is their stress level and all that. So genetic component plays a role with that. So it's a little bit of everything that can cause you to gain weight. So the way to really approach it properly is we have to look at all the causes of, so like you come to see me, but you might not like, you may be not stressful, everything is good. Then I need to find out what's going on with you. Why are you not losing, you losing weight? So I have to identify the factor that contribute toward you. So not everybody's the same. It's not the same cookie cutter. Some patients eat at the wrong timing. They don't eat a lot, but they only one meal. That meal's like late at dinner time. Well, we don't do anything after dinner. We eat after we eat, then we'll watch TV and then fall asleep. So everything we eat we'll like store, right? So that's kind of like the timing of eating is also important for weight. So we look at all of that thing, and we got to really, really evaluate the patient and then help them come up with a specific plan for that particular patient. So I cannot say that like your plan is the same as somebody else's plan because their habits are different, right?
Yes. Yeah, and I think something to kind of emphasize on too is that you're a medical doctor who knows the contributions, right? Like all of these contributions. Typically, when patients go to a regular weight loss clinic, they're only emphasizing either exercise or maybe diet and nutrition, but they don't know about the medicine and the sleeping habits and the hormones. Like these are all factors that work together to cause a person to gain weight. So you're looking at the overall picture, and I think that's really important for patients to understand that you're getting like an expert who knows like, you know, all of the contributions, not just one or two, right?
So I think that like the way that I'm very prideful about the style of medicine that we practice. So I always tell my patient that we are not a weight loss clinic. We're not a hormone clinic. We do all of those things and we're really good at it. And we're probably better than all the clinics that are out there that does weight loss and hormones. But the style of medicine that we do is that my goal is to optimize my patient's health, doing all measures that I can to get them to optimize their health, right? And so weight loss is a big thing that we do. But other weight loss clinic, what they focus on is like selling their food product, like you're eating, like so Activia. By all means, I'm not bad mouthing them, but like if you buy their food, you eat it, you lose weight. But then you don't buy their food anymore, then they gain the weight back. And that's the thing is sometimes it's not sustainable to eating like restricted diet or like, you know, go on even a weight loss medicine. But if we don't change our lifestyle, don't change the causing factor of the weight, then they will lose the weight for a short period of time, but they'll gain it back and usually gain a little bit more. My goal for my patient is to lose the weight and keep it off. I'm not in a business of keeping my patient obese all the time, just kind of to keep them, because that's not our business. Our business is how we can keep our patient optimized and healthy, right? So that's why my job is to kind of help them lose the weight and keep it off.
So my name is Kaylee Jordan, and I've been coming to DPC Health now for 2 years. My biggest thing was my weight. I had been going to the gym since 2021 for like a whole year, for 5 days a week, eating totally clean, and the weight was just not coming off. And I went to several women doctors asking them, you know, what's going on. I just don't I feel like myself. I feel like I'm in a fog. And I always just got brushed off just because I was bigger. And that was one of the most discouraging things as a woman. Our hormones contribute to our weight hugely, also our environment. And when I met Dr. Nguyen, she actually took the time, and I even cried in her office because I said I felt crazy because other doctors didn't listen. They literally just took one look at me because I was heavier. My highest, I think, before coming to DPC Health, I was 264, and now I'm at 185. And so I've totally changed everything about my weight because Dr. Nguyen and the DPC Health family has helped me get there. And it wasn't all in my brain. My hormones were totally out of whack. I'm insulin resistant. I was pre-diabetic when I started, and I'm not pre-diabetic anymore. And that's all thanks to DPC Health. So thank you.
So I want to circle back with you, Dr. Nguyen, and kind of throw you a curveball here. I think on TikTok and like social media, it's trending that people are asking to check their cortisol levels with their primary care physician because they think like, okay, obviously, like you mentioned, it's stress, and they're like, this number determines everything. And I don't see that you check it with patients. So I guess could you tell us like why that wouldn't be enough information, or like why it's not as significant?
So cortisol is like a stress hormone, right? So I think that sometimes it's a very difficult level to check is because of this. It fluctuates throughout the day. So you could check like a random cortisol, which is kind of like see where they're at. But random is like if they're at the low, you know, you really can't tell. So it fluctuates throughout the day. So sometimes it's high a certain time of the day and a low. So truthfully, if you really want to check a cortisol to get like an adequate number, then you have to do saliva testing. And it's like multiple times during the day. It's usually a little bit more expensive. So whenever I do a task, I always kind of like, you know, is it going to impact the way I treat a patient, right? So generally, if they tell me like their stresses and stuff like that, I mean, we would just recommend them to calm down and even like start them on some adaptogens. So things that can help calm the stress like ashwagandha, magnesium, things like that. So which is I recommend on a regular basis anyway, deep breathing and yoga and all that. So that's the way we would treat if the cortisol level is high. And then you would recheck it again if anything. But if patients really want to check, I can check it for them. But I always kind of think about what's the cost of the test, right? And it costs a few $100s to do that. And so generally, if like from me talking to them, I feel like they're stressful and they're anxious and stuff like that, I'll do the you know, like recommend adaptogens and things like that. So I'm not saying I don't check it. I'll check on patients who really want it. It's just that it doesn't make sense for a cost-effective way.
That makes sense. Yeah. Okay. So that's good to know. So all of the social media people checking their cortisol levels now, you know. I want to go back to the personalized weight loss plan that you've mentioned. So you say that everyone is different, so not everyone is the same. Can you kind of touch base on some of the things that you do to make sure that it's more personalized for a patient? Obviously, medications are different depending on the patient. Sometimes patients don't even want medications, right? So that's different. Even injections, if they want a skinny shot, whatnot. So like, tell me what goes into the process of you making that personalized plan.
Yeah, so generally, you know, a patient come in for a consult or a new patient. Sometimes they already know what they want to see us, and sometimes they're not sure, so they come in for a consult. So usually I will review like all the things that's going on with them, right? Like what is their desired weight? What have they tried before? Because sometimes they've tried it and it doesn't work out for them. Some patients are vegetarian, right? I cannot tell them to have low carb, high protein or keto diet if they're vegetarian. I mean, it's just like, you know, why would I? And they would feel offended, to be honest, if I were to tell them I eat a lot of meat and they're vegetarian, you know. And so I have to kind of like see what is their background, what have they tried before, what worked for them, what didn't work for them, what are their cravings. Like some people like have cravings for sweet, some are salty, and some have evening cravings. So based on that, helps me determine the type of treatment that I have to do for that patient. And then also, is there stress? Is their hormone abnormal? Like, so it depends on what they're answering me. It gives me a personalized plan for them based on that.
Yeah, that makes sense. And then kind of going back to the type of treatments, right? Like holistically, if a patient really wants to be like no medication and whatnot, you have options for that as well.
Yeah. So if like some patients like, I don't want to be on any prescription medicine, so sometimes I'll recommend like spinach extract. That's like a powder that helps with the cravings. Sometimes, yeah, that's like more natural and things like that. Green bean extract, coffee bean, green beans, those are like helpful for appetite control. They're not that greatest, but that's an option that we could use. And then if like patients don't want to be on prescription medicines, like our skinny shot is great because it's B12, methionine, isoniazine, L-carnitine, so amino acid that help with weight loss without much side effects to that. So that's good. Some patients want like prescription medicine, so phentermine, topiramate is what I prescribe a lot, but those does have potential side effects. So usually I'll talk to them about it, like it's a stimulant, so increases in anxiety and metabolism and all that, but it can increase your blood pressure. But it's a cheap medicine. So a lot of patients don't mind liking that medicine. So it works well on a lot of our patients. And then, of course, you know, you might have heard about the semaglutide and tirzepatide, right? The Ozempic and the Zepbound. That is something that's very popular, works really well, and not every patient can afford it. Sometimes they have insurance that cover for it, so we try to get the insurance approval for them. If they get that approved, that's great. And then if they don't get approved, there is a compounded version, it's a little bit cheaper, and then we can kind of talk to them about that. But a lot of the things about the Zepbound or the tirzepatide and semaglutide is that people read online. And the truth is that, like, you know, they get it online or get it from somebody who's not even managing them. So they're losing weight a lot, but they're also losing muscle along with it. So the fact that when we are doing that, like prescribing that medicine, we're actually monitoring the patient really closely, teaching them how to eat enough protein, exercise, doing their body composition, making sure they're not losing a lot of muscle. And a lot of patients, like, you know, on those medicine without monitoring, they can lose hair, they lose muscle, dry skin. And like they're having all sorts of issues with it, right? But with us, we're monitoring so closely, we can kind of help prevent some of those side effects.
Yeah, I love that. So like there's different options for the patients and what they want. And then I would say like semaglutide and tirzepatide and all of that is more like a modern day therapy that people are starting to get into, right?
Yeah.
And so I think I think you're very good at adapting to all of the latest trends and trying to figure out what's the best for patients. Now, how would you say like the weight loss incorporates with the DPC Health membership, right? Like, you know, what is the benefit of us having it here?
Yeah. So in a DPC membership, like, you know, we pretty much try to include as much things as we we can, right? So you get all your primary care needs, like, your diabetes, your hypertension, your, sinus infection, antibiotics or whatever. And then you also get the weight management plan that's all included in there, and hormone management. Like, we're managing everything together because like I talked about that, is I want to optimize my patient using all measures that I can, right, to optimize the patient's health. And so that weight management, that hormone management program is all included in DPC. So it allows me to know my patient. So for example, if you're having allergies and you're wanting to lose weight, I'm not going to give you Benadryl. I'm not going to give you like an antihistamine if I don't have to. So I would like prescribe you single layer, which is a weight neutral, or Flonase, or different measures, right? Or if like you have high blood pressure and along with it, I'm not going to give you a beta block because that's a weight gain medicine. I would look for something else like an ACE inhibitor, like lisinopril or something like that. That's not weight positive. So the way that I would manage a patient would be completely different than you have a doctor that manage something else and the other doctor, they're not talking to each other. And so if the primary doctor is prescribing weight positive medicine, or the cardiologist or the pain management, they're all prescribing different medicine. It's like this person who's working on weight loss is actually battling against this. And as a patient, you don't have that, like, nobody's talking to each other,
right.
And so the fact that we are that one-stop shop, and I actually pick up the phone and call the cardiologist sometimes, and the specialist sometimes, like, hey, my patient really want to lose weight, would you be consider like switching this medicine to this? And sometimes they don't want us to, and that's fine, but at least like I have that conversation with them, and they're like, oh, I didn't know that. Yes, that's okay to switch over. And that's kind of the way that we are the advocate for our patients.
Yeah.
I love this place. This place, Dr. Nguyen is awesome. She takes her time with you. I never have to worry that I'm being rushed out of the room because she takes her time. I don't have to wait in the lobby forever. It's usually, maybe 2 or 3 minutes, and they're calling me back and taking me to my room. And then I don't have to wait. But, I don't mind waiting because I know, again, she's taking her time with her other patients, just like she takes her time with me. She remembers everybody that I've referred, and she always thanks me for them. And I've been glad to refer several people because I think Dr. Nguyen offers an awesome product, if that's what you want to call it. I'm also a client in the other side for the Botox, and she makes me look like I'm 20 when I'm not. I love how she tries, and she comes up with ideas that, I might need this or I might need that, and I've always been grateful for everything she's done.
And also, I think like even when a patient comes in and we help schedule their first initial appointment, you're already doing the body comp, whether or not like, the patient knows, right? You're doing the body comp, and patients, when they sign up with me, they're like, okay, so what's the commitment? I'm like, well, at least 3 months, it is month to month. But even in the initial visit, after doing the body comp and kind of game planning with the patient, you're sending them home with homework, and you're asking them to come back to follow up with you in a month. And so that's kind of why we do at least a minimum of 3 months. You at least want to get them into a comfortable space as you're working with them, right? So I think like us being able to incorporate weight loss into DPC Health has been a game changer for patients, because now you're evaluating everything that you have to offer for them.
So, when I was working at USMD, I also try to do weight management, right, in the fee-for-service world. I was doing, but my schedule was way too busy. I cannot see a patient once a month. It was like every 3 months initially, and then every 6 months.
Yeah.
So if you're doing weight loss, or kind of like getting the patient in order, it's too far away. Like, I can give you some homework, and initially that first month you're very pumped, right? But then after a while, like you go on a birthday and a Christmas party and all that, and then it just kind of goes down. Yeah. But if you're like accountability, I got to go back to see Dr. Nguyen, I got to step on that scale, then they're like more motivated to be on the right track. So I think that's kind of the things I like about it.
And to kind of reverse that, because not only are you able as a primary care physician looking at all of the contributions weight gain, but now like all of the preventative stuff, like even diabetes, for instance, that can be attributed to weight, right? And so now you're treating patients with weight to help them, with their diabetes too. Can you shine a little bit of light of that?
Yeah. So like kind of going back to that, like, traditional medicine, we treat the diabetes and then the hypertension and all that first. Now you should actually treat the weight first, and then the diabetes, everything will fall together. Now, when I say treat diabetes, like, instead of putting them on insulin, which is a weight positive medicine, I would think about like, okay, I want them to lose weight. So then semaglutide, tirzepatide, metformin, things are weight negative, so that they can help lose the weight and at the same time treat their diabetes. So it's kind of like a 360 approach looking at that.
Yeah, that's perfect, because we've worked with patients about diabetes, but it's really like a whole thing, weight loss and everything. So obviously we don't have enough time to go dive dive deep into all 7 rules of your weight loss. If you want to, like Dr. Nguyen's been talking about it on Instagram, so follow us on Instagram. But why don't you give us a rule that you think is like, easy for our listeners to kind of follow through, and why you like put it in there?
Yeah, so there's a reason why I put the 7 rules of weight loss, right? So with anything, like there's weight loss medicine and everything in place, but the rules of weight loss, I put this together is mainly to set for patient to have a guideline.
Yes.
Because what our goal is for the patient to lose weight and keep it off. And so the 7 rules of weight loss is kind of a guideline for patient to kind of stay on. So if they start to gain weight, they review the weight loss rule again, am I following the rules? So I'll kind of briefly go through, like, rule number 1 is less than 50 grams of net carb. Rule number 2 is about 100 grams of protein a day. Rule number 3 is about 100 ounces of water a day. Rule number 4 is 30 minutes of exercise a day. Rule number 5 is try not to stress too much. Make sure you have enough sleep. Rule number 6 is try not to skip meal. Don't eat after 7 p.m. because you eat too late. It can cause weight gain and all that. And then rule number 7 is checking yourself. Like, so once a week, weigh yourself once a week. So these rules are mainly to help our patient keep their foundation, lose the weight and keep it off.
That's awesome. Yeah. So then you're like following up with the patient too. If like they're gaining a little bit of weight, like how can we do this? How can we do that? And you need I think you need a coach, like a health coach, to really advocate for you, right? You can hand anyone 7 rules and just be like, follow this, but is anyone really going to be able to do it on their own? Like, especially for something as big as this, right? And I think if you ever did a consult with Dr. and if you're interested, please do one. She has it listed out very well. Like, you have a time schedule when you should drink water and like how much to eat and like even recipes and a food period. Like, it's all well put together, and it's like on like a Microsoft Word doc, whatever, but it's like it's useful information that I think patients can really take with them and like at least start the foundation, like you said, right?
Yeah, because sometimes like you see TikTok trend to do this and that, but there's not really a solid like how to do it, right? So this, like, we really put it down to like, it's very easy to follow because it's not something that's so strict that you just can't, like, because when you go on a diet, right, for a short period of time, you lose the weight, but you gain it back. So this rules of weight loss is like not too strict, but it's enough for you to lose the weight and keep it off and maintain on this new lifestyle change. So I call it a lifestyle change, not exactly a diet, because diet, you'll fall off a diet, but a lifestyle change you'll keep for a long time.
Yeah, and I mean, I don't know if you have like a quick story of somebody that you love to share about with weight loss, but I've seen such an impact you have for patients. Even when we ask them to do testimonies, they're all talking about weight loss or hormones because they're like, this is like my thing, we do so well. And we have patients who like will explain, like, I was from like 2 extra large to now like being a size large, and they're so proud of themselves. And even when I run into patients outside, they're like, okay, I need to push my appointment with Dr. Nguyen back like maybe 2 more weeks just so I can like lose a bit more weight. So like they're really active in doing it, and I think that you put it well together so that patients like trust you and like really want to work with you.
Yeah, I think that like they can sense my excitement when they come in. It's like, oh my gosh, look at this! You lost 7 pounds of fat, gained 2 pounds of muscle. Like, I get excited, like for my patient, right? Because I know they work really hard, and seeing the result, it really excites them. And so like, and I mean, the other day I've got a patient, like, I've seen her for months now, and she was very skeptical initially, only losing a few pounds, and then like, she still stayed patient with me and kind of keep working at it, and I think now she's down 50 pounds.
Awesome.
And she is so happy, and Christmas is almost here. She's going to get her to wear her Christmas dress, and so it's just exciting to see. And then like, especially when you see they lose weight and they start crying and how like, amazing things have changed for them. It's not just about the weight that they look or how they look, but how they feel, and now they're confident in themselves. And so I think that really makes me happy as a doctor, wanting to come to work every day and kind of building this team, and we're changing lives day by day. It's not just like, I love the ER medicine of like, saving from somebody from like a heart attack, but yet, that is nice to change at that, but this is like a long-term change, right? And I feel that that's such a beautiful thing, and it really excites me as a physician of being able to do the work that I do.
Awesome. Well, thank you, Dr. Nguyen. That's a great story. This is awesome. Please come see us at DPC Health for any weight loss or primary care needs. Dr. Nguyen can take care of all your things at DPC Health, where medical care is redefined.
Bye.